I'm Dr. Frita, and today I'm giving you 5 nighttime habits that can secretly cause chronic kidney disease. Number 3 is hard to stop. I'm a board certified kidney doctor and high blood pressure doctor, and over the years, I have taken care of so many patients with chronic kidney disease that has been caused largely by nighttime habits. Yes, there are many nighttime habits that people do every day, and they have no idea that they can actually be causing chronic kidney disease. Over 35 million Americans have chronic kidney disease, or CKD, and most don't even know it. We know that certain diseases like diabetes and high blood pressure can cause kidney disease, but did you know that some everyday nighttime habits like having a bag of salty chips before you go to bed could actually also cause CKD? Well, if you didn't know, you're about to find out because I'm giving you 5 nighttime habits that can secretly cause chronic kidney disease. Keep watching. Be sure to download your copy of my book. It's called Under Pressure. It's your step-by-step guide on how to control high blood pressure. This book is packed with valuable tools, guidelines, and information to help you to control high blood pressure. Click the link in the description to get your copy today. What if I told you that just one single thing you do every night could be causing chronic kidney disease? Well, I'm Dr. Frita, and as a board certified kidney doctor, I actually tell my patients things like this every day when I share these nighttime habits. So let's go ahead and get started and see if I'm talking to you. Number 1, indulging in late night high sodium processed snacks. Yes, if you're someone who likes to grab a salty bag of chips before you go to bed, or maybe some salty buttery popcorn, cheese and crackers, maybe a little hot dog or a salami sandwich, or perhaps even a frozen low-calorie dinner that happens to be high in salt, then this nightly habit could certainly cause kidney disease. How does it do it? Well, when you take in high sodium or high salt, that causes you to retain water, okay, to retain fluid in your blood vessels. When you do that, it leads to high blood pressure, and high blood pressure is the second leading cause of kidney disease. What to do about it? Avoid late night high salty foods. So instead of grabbing that bag of chips, grab a bowl of berries or some apple slices or some unsalted nuts. Make sure that you're a label watcher and so that you avoid high sodium foods. According to the American Heart Association, it is recommended that most adults take in no more than 1,500 milligrams of sodium or salt a day. So if you're indulging in high salt snacks before you go to bed, that's one nighttime habit that can certainly cause CKD. Be sure to click the link in my bio or to go to my one-stop shop, dr.frita.com, to get a copy of my book, Under Pressure, a guide to controlling high blood pressure. Number 2, eating too much protein right before bed. Did you know that when you eat high amounts of protein, this creates waste that your kidneys are responsible for filtering out? Now, if you are a person who already has CKD, or if you are vulnerable to having kidney disease, like if you have diabetes or high blood pressure, then having your kidneys to do all this extra work while the rest of your body is trying to rest could actually worsen kidney disease. Here's what to do. First of all, consult with your doctor and your registered dietitian to find out how much protein intake is appropriate for you. If you learn that you have CKD or that you are vulnerable to kidney disease, then instead of having super high protein right before you go to bed, try to have plant-based protein, or perhaps consume lean meats, but balance them with fruits and vegetables in your diet. Bottom line, if you have CKD or if you are vulnerable to kidney disease, understand that having super high protein right before you go to bed is definitely something that could worsen your kidney function. I'll tell you, this is something that I see in my practice daily because, of course, they're trying to be healthy, and many of my patients exercise and they have personal trainers, and what they're told is that you need to eat high amounts of protein. And so they might be eating 100 grams of protein a day, 150 grams of protein a day, really trying to build their muscle mass. But if they have CKD, then eating this super high protein can actually make their kidneys worse. So be careful. And again, always consult with your doctor. Number 3, holding urine overnight. Now, this might be a hard habit to stop. You know how little kids will hold their urine if they're doing something fun, like playing in the playground or doing a video game. And sometimes adults will hold their urine, especially if you're away from home and you don't want to use the nasty public bathroom. But another common evening habit is holding your urine overnight. And this is not a good idea because it can cause kidney disease. Here's how. When you hold your urine in your bladder, then over time, bacteria can grow and multiply. If this keeps happening, then that bladder infection can ascend. It can go up through the ureters and into your kidneys, and it can cause a serious kidney infection or pyelonephritis. Now, if you end up getting kidney infections recurrently, if they happen over and over again, then this actually can lead to a decline in your kidney function. So what do you do about it? Listen to your body, and when your bladder is full, use the restroom. Even if you are asleep, if you're having good old sleep and you don't want to get up because it's cold or it's uncomfortable if you get out of bed, never mind that. Get up and empty your bladder in order to avoid getting a bladder infection and in order to avoid having CKD. Question: how many of these nighttime habits do you currently practice without realizing their impact? Please comment down below. Number 4, ignoring signs of restless leg syndrome or nighttime cramps. If you are a person and you notice that when you're sleeping, or if you are taking a quick nap, or even if you're just sitting still and your body is at rest, if your legs jump around or kick, or if they're restless, or if you really notice that you're having cramps at night, then this could be restless leg syndrome. And if you ignore it at nighttime, that's not a good habit. Here's what happens. Patients who have restless leg syndrome often have a mineral imbalance or some type of an electrolyte abnormality. Having these imbalances is something that is quite common in patients with CKD. And yes, many of my patients with kidney disease often have restless leg syndrome, and the restless leg syndrome is oftentimes a good warning sign that you could have kidney disease. So what can you do about it? Never ignore your body. If your legs are jumping around at night, you know that's not normal. Make sure you talk to your doctor right away. Let them know that you think that you might have restless leg syndrome, and ask your doctor, do you have chronic kidney disease or CKD? And be specific, because oftentimes doctors will look and they'll glance at your labs, and if nothing shows up red, they'll say, your kidney function is fine. But here's the truth of the matter. Even if you have CKD stage 2, that's not normal, but it's not going to light up as being abnormal on your labs. So ask your doctor very specifically, what is my BUN? What is my creatinine? What is my eGFR? Be your own advocate. So if you have restless leg syndrome, what you want to do is not ignore the symptoms, but make sure you go in and find out if indeed you have CKD. Be sure to watch my video on CKD stages after you finish watching this video. Number 5, ignoring your thirst or drinking the wrong things at bedtime. Here's what happens. If you ignore your thirst and you go to bed thirsty, that means that you are likely dehydrated. If you are dehydrated, then your kidneys are not going to get the proper blood flow, and this can lead to something called pre-renal azotemia, which can ultimately lead to CKD. Also, if you drink the wrong things at night, that can lead to CKD. So, for example, drinking really sugary drinks or caffeinated beverages or alcoholic beverages, all of these things can worsen kidney function at night. The sugary beverages, we know, can increase your risk for diabetes, and diabetes is the number 1 cause of kidney failure. Also, if you're drinking a lot of sugary drinks and you have diabetes, it can worsen blood pressure. Drinking caffeinated beverages like sodas, coffee, tea at night, well, this can do a couple of things. The caffeine, in some cases, can worsen your blood pressure, okay? And we know that high blood pressure is the 2nd leading cause of kidney disease. Also, caffeine acts like a water pill or a diuretic. And so if you're drinking a lot of caffeine at night, that can actually make you urinate more, which will dehydrate you, and this could lead to pre-renal azotemia and ultimately CKD. Here's the deal with alcohol. Drinking alcohol at night is a habit that could also lead to kidney problems because alcohol can dehydrate you. And here's how. Alcohol inhibits your ADH, or your antidiuretic hormone. This causes you to urinate more and to get rid of water. And so if you have an evening habit of having a little nightcap or having a little alcohol, then this also can dehydrate you and secretly lead to CKD. So here's what to do. Number one, make sure you never get dehydrated. Drink water all throughout the day. Take sips and consult your doctor to find out the right amount. But for most people, drinking 2 to 3 liters of water a day. So if you think about the 16-ounce bottles of water, drinking about 4 to 6 of those a day is proper hydration for most adults. But again, if you have chronic lung disease or congestive heart failure or liver disease, you might be on a fluid restriction. So consult with your doctor. Either way, you want to sip water throughout the day to make sure you maintain the hydration that's proper for you. Also, it's a good idea to keep a little glass of water by the bed. And so if you do get thirsty at night, you can sip a bit through the night. It's important not to just load up and do the bulk of your water drinking right before you go to bed because, oh my gosh, you don't want to have nocturia or even a little bit of an accident. And yes, honey, adults can have nighttime accidents as well. At any rate, you don't want to get into the nighttime habit of ignoring your thirst because we know that maintaining good hydration is a great way to prevent CKD. Question: what's one small change you plan to make to your evening routine this week to help protect your kidneys? Please comment down below. So there you have it. These are 5 seemingly minor nighttime habits that can have major consequences when it comes to kidney health. And make sure you give yourself grace. You're not going to be perfect and change everything in just one swoop. But if you make just one minor change at nighttime tonight, that could have a major change in your kidney health. So give it a try. If you found this video to be helpful and informative, please be sure to like it and to share it with the people you care about. Also, to keep the conversation going, be sure to join me every Monday at noon Eastern Standard Time, where I do a live stream on celebrity health and all of the hot health topics in the headlines. There we are interacting with each other live. You can ask me questions, I can ask you questions, and together we can come up with strategies to live our healthiest, happiest lives. I appreciate you for watching. I appreciate you for the support, and I want you to continue to do your best to live your healthiest, happiest life. I'm Dr. Frita.